Hello everyone, I'm Sonali Gunasekara, a PhD student from ECLIPSE Sri Lanka team. My study is about developing, implementing and assessing the feasibility of a community-based intervention to improve health-seeking behavior in CL in rural Sri Lanka. This is the outline of my presentation today: introduction and objectives, methodology, progress and insights, and finally the reflections and questions. As an introduction to the research topic, health-seeking behavior in CL, it has been defined by the Ramdas as the whole process of thoughts, actions, and behaviors of people in terms of their seeking or not seeking treatment for CL. This will be the basis for the present study. This study aims to assess community awareness of CL, to develop an explanatory model on health-seeking behavior in CL, to systematically review the community engagement and involvement in community-based interventions, to develop a community-based intervention to improve health-seeking behavior in CL, and finally to assess the feasibility of a community-based intervention to improve health-seeking behavior in CL in rural Sri Lanka. The aforementioned objectives will be achieved using 5 study components. Study component 1 will be an ethnographic study. This ethnographic study will use 4 main data collection methods, including participant observation, focus group discussions, in-depth interviews, and a diary study. Qualitative data generated from the ethnographic study will be subjected to the analysis based on the principles of grounded theory. Ethnographic study has already started and data are generating. So the study component 2 will be an awareness survey. This awareness survey will be conducted in the same field site where the ethnographic study is conducting. An interview administered questionnaire will be delivered during this household survey to assess the awareness on disease, symptoms, and treatment options of the community in a disease endemic region. The quantitative data generated from the awareness survey will be subjected to the analysis of descriptive statistics. Data generated from the ethnographic study and from the quantitative survey will be utilized to develop the explanatory model on health-seeking behavior in CL under the study component 3. The study component 3 or the explanatory model will be the basis for the development of community-based intervention to improve health-seeking behavior in rural Sri Lanka. That is study component 5, and this study component will be complemented using the findings of the systematic review on community engagement and involvement in community-based interventions under the study component 4. Finally, the feasibility of the developed community-based interventions will be assessed using different measures. And as the progress achieved so far, I have completed my initial registration and submitted the concept paper. Concept paper is the initial document which is similar to a rough proposal which needs to be submitted for the initial registration as the requirement by the Rajarata University of Sri Lanka. Now I am in the process of developing my detailed proposal, and I have already prepared the awareness questionnaire needed for the quantitative survey and has obtained expertise inputs for this awareness questionnaire from the ECLIPSE senior research staff. From the ethnographic study, I have already started it since last March, and I had to stop it temporarily due to the prevailing situation of the country. Now I am continuing a diary study with a selected group of community members from the field site for a 1-month period. In terms of the lateral work, I have completed several online courses in Coursera and has attended to local conferences and made few abstract publications and a full paper publication in other research areas apart from the leishmaniasis during this time period. This is my field site. It is located in a rural area in Talawa Medical Officer of area. It is basically an agricultural community where has a huge historical value in the located geographic location, and lots of collective community actions are taking place in these field sites. I have selected only one example, which was a narrative presented by a inactive CL patient in my field site. He was a male person and I met him at the monastery of the village. He explained me how he perceived the disease, symptoms, and the treatment experience. I caught. First, it appeared as a red spot. I didn't care much. Then it became a lesion and didn't heal. I visited the doctor in the hospital here. He gave some ointments. It took months, but no progress. At the last time I visited the doctor, he asked from me, didn't it heal yet? He asked me to go to Anuradhapura hospital. After a test, I got to know that a sandfly has bitten me. Even today, I don't know from where it bit me. End quote. That's how he explained me how he first noticed the symptoms and then access to the healthcare setting. He also explained me his disease experience. I thought, oh my, I had injections for 6 months at Anuradhapura Hospital. There is a clinic room at the hospital called 15 or 16 room, which is filled with the people who were bitten by sandflies. Injections are given directly onto the lesion. I clench my teeth to tolerate the pain. Old people who enter into that clinic room well with the pleasant face comes with the bitter face. Little children scream so miserable. That's how he explained me the treatment experience. And also he explained me how he perceived the disease and its causation. He told me that I have heard that when the female sandfly bites, it becomes worse. She lays eggs on the bitten side. Then tiny sandfly babies are born and they travel through blood veins. They suck blood. If they reach out to her, then it becomes worse. So that's how they think. And the expected outcomes of my study or the publications that I expect to make are community awareness of CL in a disease endemic community, developing an explanatory model on health-seeking behavior in CL, systematic review on community engagement and involvement in community-based interventions, community-based intervention to improve health-seeking behavior in CL in rural Sri Lanka. Within this short time period, engaged in ethnographic fieldwork, and for the whole study, I have faced few challenges because I am new to ethnography. So it was a challenge for me and dealing with my role in the community as a participant and same time as an observer. And the newest or the existing most prevailing challenge is COVID-19 and moving forward with my research activities. So already I have planned this to move forward with the diary study till the situation gets better. However, these challenges were overcome using my background of health promotion and my community-based interventions carried out last few years. And the community engagement and involvement in each and every step was a strength to me. And finally, the most important thing is that I feel that I am becoming a part of this community now. Even though I'm not in the field these days, they update me and they carry out normal process of providing inputs for the success of my study. So I wish all the other PhD students to make their studies success and may those activities will benefit the community. Thank you.